Okay, we are on chapter 29, collecting and testing specimens. You know how to study now. You know how you need to check everything in the book for adjectives, keywords, and key abbreviations in order to get that 70% or greater. We will bypass the contents because it's right there. You know what you have to study. Most specimens are tested in the laboratory. Some tests are done at the bedside. The requisition slip has the person's identity information and the test order. The specimen container is labeled according to the center policy. Specimens or samples are collected and tested to prevent, detect, and treat disease. The doctor orders what specimen to collect and the test needed. All specimens sent to the laboratory require requisition slips. The random urine specimen is collected anytime during a 24-hour period. Urine specimens are collected for urine tests. The random urine specimen is collected for a routine urinalysis. No special measures are needed. Many people can collect the specimen themselves. Weak and very ill persons will need help. And remember, the random urine specimen is collected anytime during a 24-hour period. The midstream specimen. Cleansing the perineal area reduces the number of microbes in the urethra area. Stopping the stream of urine is hard for many people. You may need to position and hold the specimen container in place after the person starts to void. Pour about 120 milliliters, 4 ounces, into the specimen container. They will need at least that much in order to do the test correctly. The midstream specimen, also called clean void specimen or clean catch specimen. The perineal area is cleaned before collecting the specimen. Sterile gloves are needed. A sterile specimen container is needed. To collect the specimen, the person stores the void into a receptacle. Then the person stops the stream of urine. A sterile specimen container is positioned. The person voids into the container until the specimen is obtained. You may need to position and hold the specimen container in the place after the person starts to void. Midstream specimen, that's how you would do it. Have them sitting there, and that's how make sure your gloves are on. And the gloved hand at the top is going to be, it would be contaminated because you are holding the labia and near the hair. Collecting specimens with a specimen pan. As you can see, you have one pan for urine and the other one be for stool. You need to, the left side, the specimen pan is placed at the front of the toilet on the toilet rim. This pan has a color chart for urine, and the specimen pan is placed at the back of the toilet for the stool specimen on the right hand side. The 24-hour urine specimen. The person and nursing staff must clearly understand the procedure in the test period. The test is restarted if the void was not saved, toilet tissue was discarded into the specimen contains feces. You have to restart it all over again. The 24-hour urine specimen, all urine voided during a 24-hour period is collected. The time that it started will be written on there, and you write the time that it ends. Urine is chilled on ice or refrigerated during this time. It's always really chilled on ice. A preservative is added to the collection container for some tests. The person voids to begin the test with an empty bladder. Discard this voiding. The first voiding is discarded. Save all voidings for the next 24 hours. Urine testing. The nurse may ask you to do simple urine tests. Glucosuria glycosuria means sugar, glycose in the urine. The diabetic person may also have keto bodies, acetone, in the urine. These substances appear in the urine from the rapid breakdown of fat for energy. The body uses fat for energy if it cannot use sugar. Urine is also tested for ketones. Injury and disease can cause hematuria, which means blood in the urine. The pH, urine pH measures if urine is acidic or alkaline. Normal pH is 4.6 to 8.0. A routine urine specimen is needed. Testing for glucose and ketones, these tests are usually done 30 minutes before each meal and at bedtime 4 times each day. The doctor uses the test to make drug and diet decisions. Double-voided specimens are best for these tests. Testing for blood, sometimes blood is seen in the urine. At other times it is unseen. Occult means unseen. A routine urine specimen is needed at this time. Testing samples, you'll see that's a urine strip over there. On the right hand side, they pouring the urine through a drainage into the graduate. So, and it's that strip that you see is called a reagent strip or dipstick for sugar and ketones. Okay. Testing urine reagent strips, dipsticks, have sections that change color when they react with urine. Review promoting safety and comfort using reagent strips in the textbook. Review the testing urine with reagent strips procedure in the textbook. Also review the straining urine procedure in the textbook. The person drinks 8 to 12 glasses of water a day to help pass the stones if there are suspected of stones. Expect the person to void in large amounts when that's done too. Using reagent strips, do not touch the test area of the strip. Dip the strip into the urine. Compare the strip with the color chart on the bottle. Follow the manufacturer's instructions. When you're straining the urine, a stone calculus can develop in the urine, urethra or bladder. Stones can vary in size, stones causing severe pain, and urinary system damage may require surgical removal. Some stones are passed through the urine though. Stool specimens. The person uses one reciprocal for voiding and another for a bowel movement, BM. Some tests require a small stool, a warm, small stool. A specimen is taken at once to the storage area for transport to the laboratory. Stools are studied for blood, fat, microbes, worms, and other abnormal contents. The stool specimen must not be contaminated with urine. Testing stools for blood. Ulcers, colon cancer, and hemorrhoids are common causes of blood in stool. Occult blood test kits vary. Follow the manufacturer's instructions. When internal bleeding is suspected, stools are checked for blood. Testing stools for blood will be often blood is seen if bleeding is low in the bowels. Stools are black and tarry if there is a bleeding in the stomach or upper GI tract. Sometimes bleeding occurs in a very small amounts and cannot be seen. Occult blood. The test is often done to screen for colon cancer. Ulcers, colon cancer, and hemorrhoids are common causes of blood in stools. Okay. Testing stools. A tongue blade is used to transfer a small amount of stool from the bedpan to the specimen container. Testing for occult blood. In A, the stool is smeared on box A. B figure, the stool is smeared on box B and then the flap is closed. C, a developer fluid is applied to boxes A and B on the back side of the test packet. And D, color changes are noted. And it would if it's positive, it would be an indicator on there to show you if it's positive or negative and negative. Sputum specimens. Sputum is not saliva. Saliva is spit. It's a thin, clear liquid produced by the salivary glands in the mouth. Coughing up sputum that contains blood is called hemoptysis. Coughing up sputum is often painful and hard to do. To collect a specimen, follow the rules in box 29 in the textbook. Also have the person rinse the mouth with water. Rinsing decreases saliva and removes food particles. Mouthwash is not used. It destroys some of the microbes in the mouth. Here are 3 positions used for postural drainage. See, there's different ones. You see how the pillows are adjusted, repositioned, and those are the 3 positions that they will use, and then they can usually get it spit out. Blood glucose testing. The doctor uses the results to regulate the person's medications and diet. A drop of blood is collected. A finger tip is the most common site for skin punctures. This provides easy access and clothing is not removed. With some meters, you can use the forearm, thigh, or fleshy part of the hand. Blood glucose testing is used for persons with diabetes. Capillary blood is obtained through a skin puncture. You use a sterile disposable lancet to puncture the skin. A glucometer measures blood glucose. Blood glucose testing. Calluses often form over frequently used areas such as the tips of the thumbs and index fingers. Therefore, thumbs and index fingers are not good skin puncture sites, especially on men. The lancet punctures does not cut the skin. The lancet is inside a protective cover. Do not touch the blade. Discard it into the sharps container after use. To perform a skin puncture, you inspect the site carefully. Look for signs of trauma and skin breaks. Do not use sites that are swollen, bruised, cyanotic, bluish color, scarred, or calloused. Do not use the center, fleshy part of the fingertip. Use the side toward the tip of the middle of the ring finger. You apply a drop of blood to a reagent strip. Then you insert the strip into the glucose meter. The blood glucose level appears on the screen. Many types of glucose meters are available. Follow the manufacturer's instruction. And there's a picture that shows you the middle finger and shows you where you can do the stick. There you are, checking the glucose level, and then putting the strip in. Always make sure you follow each glucometer in the way you would insert the strips because they all are different. Every company has a different method of how to do it. Okay? Checking glucose level. When the blood is on there, it should show a little drop of blood, and then it will read it. A lancet for prickling the skin, a drop of blood is applied to a reagent strip. And the reagent strip is in the glucose monitor, and the result is displayed on the glucose monitor. You must collect for quality of life. You must collect and test specimens on the right person. Otherwise, one or more persons could suffer harm. Before collecting or testing a specimen, carefully identify the person. Check the identification ID bracelet against the laboratory requisition slip or assignment sheet. Compare all information, not just the person's name. Some centers require placing the collection data, collecting time, and collector's name and initials on the container. This promotes safety, follows center policy for labeling specimens. Always act professionally. Do not say things that may embarrass the person. Specimen collection embarrasses many people. To promote comfort and privacy, publicly ask visitors to leave the room. Close doors, the privacy curtain, window coverings. Leave the room if it is safe to do so. If you cannot leave, explain this to the person. Place the specimen container in the paper bag or wrap it in the paper towel or washcloth so others do not see the specimen. Promote comfort by explaining the procedure to the person. Some people can collect their own urine and sputum specimens. Doing so promotes independence and helps reduce embarrassment. Show the person the specimen container and how to use it. Ask the person where to place the container so the person knows where to find it. This is the end of Chapter 29 of Collecting and Testing Specimens.